Drowning is a condition characterized by acute respiratory failure resulting from immersion involving a part of the body with the airways or submersion involving the entire body. It is most prevalent in two age groups, around 5 years old and between 15 to 25 years old. To understand the severity of drowning, it is important to classify it into stages. According to the NVS, there are 4 stages. Stage 1 or aqua stress, where the water is not inhaled. The majority of symptoms during this stage are anxiety related, including tachycardia, hyperventilation, and tremors. Stage 2 includes minimal inhalation of water followed by rapid extraction. Symptoms in this stage include cough, dyspnea, tachypnea, cyanosis of the extremities, and hypothermia. Stage 3 or major hypoxic present with the respiratory distress syndrome. The final stage or stage 4 present a state of cardiorespiratory arrest or near arrest. Hemodynamic or pulmonary edema is one of the respiratory complications, which may result from an overload of fluid in lungs. Hypovolemia or low blood volume, arrhythmias or abnormal heart rhythms, and myocardial failure are among the most common cardiovascular complications. Neurological consequences are significant in drowning cases. Cerebral anorexia caused by a lack of oxygen supply to the brain is a major concern. Increased pressure inside the skull can also occur. Other impacts of drowning vary between hypothermia, unusual drop in body temperature, hydroelectric disorder, which is an imbalance of body fluids and electrolytes, and coagulation disorder. The treatment of drowning focuses primarily on managing respiratory distress and addressing any associated hemodynamic and visceral failures. When the drowning incident occurs in the water, the priority is to extract the person as quickly as possible while maintaining a proper alignment of the head, neck, and the trunk, and keeping the airways open is important. And if there is no spontaneous ventilation, 5 inhalation should be provided. After being removed from the water, an immediate assessment is conducted to evaluate the person's neurological, respiratory, and hemodynamic conditions. If the individual experienced cardiac arrest, CPR is promptly initiated. This involves opening the airways, delivering artificial ventilation, performing chest compressions, and supplying oxygen through a back valve mask device. Systematic measures are used to keep the person's body temperature stable, including removing any clothes, drying them off, protecting them from the wind, and giving them thermal blankets. Once emergency service arrives, specialized assistance is given. Medical management entails keeping an eye on the patient, setting up a peripheral intravenous line using isotonic saline solution, and running various tests ranging from a complete blood count, serum electrolyte analysis, renal function tests, blood glucose measurement, coagulation profile evaluation, and chest X-ray or ECG. Depending on the circumstances, additional diagnosis procedure can be performed. Specific treatment approach depends on the severity stage of drowning. For stage 1, reassurance, warming, and blood glucose control are provided, and hospitalization for at least 24 hours is recommended. In cases of stage 2, gastric emptying is performed, and hospitalization for 48 hours is typically required. Major hypoxic or stage 3 requires an intensive care unit hospitalization. Intubation for mechanical ventilation and hemodynamic support is important in this case. For stage 4 or anoxic drowning, CPR is crucial, and efforts are made to manage acute cerebral swelling and maintaining a mean perfusion pressure. Antibiotic prophylaxis may be considered if infection is suspected. Thanks for watching.